morning. This is Saurabh Rajpal for Fits on the Go blog, and I have with me this morning Dr. Bernard Gersh and Dr. Christopher Granger. Good morning.
Yeah, morning. Morning.
How do you feel today for this meeting?
It's great. I'd be much happier if it stopped raining.
Yes.
I think it was, the meeting's been, I think the most exciting thing in the meeting so far for me has been the SIMPLICITY trial.
Okay.
And it's been a very good meeting, but maybe in that and the CoreValve.
The CoreValve is pretty exciting.
CoreValve is pretty exciting.
Yes. And what do you think about the results so far?
Well, SIMPLICITY was a neutral trial, and no one expected that to be the case, but it is overwhelmingly neutral. There's nothing there. So the big question is this the end of renal denervation, or will we see other trials with different catheters that may or may not be more effective? I think my own feeling is probably this procedure doesn't work, but I suspect that it's premature. I suspect that we will see some other trials. Mm-hmm. But I think what's very important, it was a blinded trial. Yeah. Nothing up until now has been blinded.
And that may be the lesson, Bernard, for fellows, right? Is here we have two trials presented back to back. The CoreValve, really high quality randomized trial showing that transcatheter valve replacement really looks good in this high risk group, even compared to surgery. And it took a rigorous trial to be able to show that. And the stroke rates, importantly, were comparable. They were not higher with the valve implant compared to the earlier data with partners. And then the renal denervation. We all thought that it would be very effective based on some smaller promising trials, but the lesson, I think, is we've got to wait for the proper, rigorous, randomized
and
sham-controlled
blinded. I mean everything had been up until now had been overwhelmingly positive.
So maybe the biggest winner is the randomized trial.
Yeah, I'd say that. Thank you very much.
Thank you. And what do you think the fellows how can the fellows make best of this meeting?
Oh, I think what I would do as a fellow, I would sit down and plan your day, and don't just wander around. I really would plan the day, because there's an awful lot here. Yes. And maybe even the late-breaking clinical trials, which get all the headlines, you can get that in hot.org. I mean, I would go to focus on a lot of the sessions that are case-based, with a lot of discussion. But plan the day, don't just arrive and look for inspiration.
And I think the American College of Cardiology does a great job with fellow support, fellow training,
they do.
Education, and creating a community of fellows to interact with each other, share the enthusiasm of this great profession, this great specialty that we're in, all the interesting stuff that's going on.